One of the other trends that I would have never even thought, and during my training never even imagined I would be part of, is something called the Pulmonary Embolism Response Team. PE, or pulmonary embolisms, have been no one really owned pulmonary embolisms, if you want to call it. I mean, it was the pulmonary physicians always treated them just because that was because patients showed up in their offices or in the hospital and they were the first ones to be called. But our treatment for pulmonary embolism has been lacking. People who show up, or patients who show up with the massive or submassive pulmonary embolisms and can be crippled for life because of things like pulmonary hypertension that can develop if those pulmonary embolisms are not treated appropriately. We've become a lot more aggressive, and now the catheter-based mechanisms for treatment of pulmonary embolisms have evolved significantly. What we know is that if we give clot-busting medications, or TPA, to these pulmonary emboli, patients tend to do better. But we also know that TPA, or clot-busting medication, can cause significant bleeding, including intracranial and abdominal bleeding. So what we've done is we've created pulmonary embolism response teams, and we created one of those actually at Southside also, which was to, as soon as a massive PE or a submassive PE patient presents themselves in the emergency room, the interventional cardiologist, cardiothoracic surgeon, pulmonary, hematology, and our critical care team are involved right away. And we basically make a best decision as to how to treat these patients. Number one, is that patient going to surgery for an embolectomy? Is this patient going for full dose TPA? Or is this patient better off with a catheter-based technique to put up catheters inside the heart, through the heart into the lungs, and essentially drip clot-busting medications for 12 to 24 hours, and then reassess? And this has been a phenomenal program, and we've developed this and have brought in patients from out east, from Peconic Medical Center, from Huntington, from other hospitals in the eastern region of Southside, to really grow this program and make it into a new entity. And it's something that's very unique to Long Island. Because I think probably another decade, I think this will be a trend which everybody will be following, but I think we're definitely at the forefront of this at this time.